Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner. I'm coming to you, as always, with Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon, and he is, and I am, technologically advanced. We are in 4K.
We're 4K.
Yeah. We've made some updates this new year.
You're going to see how poor our pores look.
Right? Like, don't look closely.
Yeah.
So we got some upgrades. We're
just going to keep on going with this.
Yeah. We're going to be animatronic before we know it. So, Dr. Martin, we have a great topic to talk about today.
Yep.
We are talking everything you need to know about that word that tripped us up in 2023.
Yes.
Oh, that was brachioplasty.
Yes,
but
brachioplasty.
Blepharoplasty. The one that gets me.
So it's eyelid surgery, eyelid tuck.
It's not eyelid. No one calls it an eyelid tuck.
You sure?
I am positive.
What do the lay people call it? What's on the streets?
You know,
right
the
now?
only person I've ever heard call an eyelid surgery an eyelid tuck is you.
I'm on the streets,
Yeah.
Amy.
So
I went out on the streets for this episode,
most people
even
call
though
it
it's
an
5
eye
degrees
lift.
outside. Yeah.
eye lift, just like we don't call it a face tuck. We call it a face lift.
Right.
Eyelid lift, eyelid surgery.
Lift. Yeah. Okay.
We're going to talk about upper and lower. We do these series. We did a few last year in 2023, kind of breaking down the reel from the start of your consultation all the way through to you recovered from surgery. And that's what this is going to be. So
I love these.
as we do, Dr. Martin, we're going to start off talking about the statistics. We are still looking at statistics from 2020. The 2021 should be out really soon. We're always a couple of years behind, or the society is always a little bit behind. So 2020 is that year that kind of skewed everything.
Yeah.
However,
Yeah. I mean, it's so hard to use these numbers.
yeah, with eyelid
The
surgery,
world
though, changed very little. I mean, there was a slight decrease, but not like we've seen with other procedures, which does kind of show that in 2020, we were still looking at ourselves a lot. And what we were focused more on was probably our eyes, because the lower part of our face was covered up.
With a mask.
So I think that is really interesting, because we did see such a massive drop in a lot of surgeries in 2020, whereas blepharoplasty stayed pretty static. I mean, there was an 8% change, but you take plus or minus, that's pretty minimal. So still more women than men do this procedure. Women took about, more than 2/3 of the category here. And then the age ranges is pretty much what we see, some in the 30s, more so in the 40s and 50s, a little bit more so in the 50s and 60s, and then we kind of drop back off again in the 70s and over, which is usually when people would be going back in for a touch-up of their eyelid surgery.
Right.
Most likely. So I thought that was really interesting. I mean, of all the 2020 things we talked about, this was the one thing I'm like, oh, that does make sense, because masks.
Yeah.
Yeah, were a thing.
And faces, too, because of Zoom.
Eyes were still showing.
Yeah.
So, yeah. All right. Dr. Martin, what are things that a blepharoplasty can treat?
So should we establish the fact that blepharoplasty is one of my favorite surgeries to do? If we establish that or no?
Well, you say that about every surgery we talk about.
This one's my true favorite. It's like having children, everyone's your favorite, but you have some that are more favorite than others. So
You want to talk about your favorite tree next?
yeah. So blepharoplasties, eyelid lifts, tucks, whatever word we're going to use, really address what you would imagine it addresses, the upper and lower eyelids. And there's two things with the upper and lower eyelids that it primarily addresses: extra skin and fat that herniates out, that kind of makes the appearance less desirable. So as Amy said here, loose or sagging skin of the upper eyelids, that actually can impair vision for sure. We get a lot of people like that. Sometimes in extreme cases, insurance will cover it. But the eyelid skin can hang over and affect your peripheral vision. Amy, what directions?
To the side.
Up and out, and actually to the side. And that can be a real health hazard. The fatty deposits that she also put on here on the uppers and lowers. Less on the uppers. We used to clear that out a lot in the old days. We don't as much anymore.
No, we rarely do that now.
And then a little more on the lowers to take the fat out, so that kind of herniated fat that pops out that makes you look, your eyes swollen and tired, kind of the appearance that people don't like. The under eye bags, which includes skin and fat, and then also she included here drooping lower eyelids. And definitely eyelids are a very complicated anatomical structure. It's hard to address those surgically. And you can go quickly from cosmetic to reconstructive. And people can have drooping lower eyelids from age, from birth, from trauma, from nerve injuries. And a lot of these surgeries mix between the cosmetic stuff, which I primarily do, and reconstructive, just to help people have a functional lower eyelid. Wrinkles on the skin itself can be improved with these surgeries, but those are primarily treated with external treatments like lasers and radiofrequency treatment. So
Botox.
Yeah, I mean, blepharoplasty does a lot of stuff.
Yeah.
And you can do a blepharoplasty and do specific things on one case and not on the other. So it's not like a tummy tuck used very similar all the time. There's a lot of nuance to blepharoplasties.
Yeah, absolutely. So there are, though, some things that a blepharoplasty cannot or will not do, and that is remove all lines or bags around the eyes, as much as people want them to go away completely.
This is not what TikTok said, Amy.
Yeah.
This is unfortunate.
And like all things, unfortunately, surgery does not stop aging. So these processes will continue. Now, if you time your eyelid surgery appropriately, you may only need one. However, most people, as we kind of saw with those numbers too, I think that shows that it's probably something that you will need to do multiple times throughout your life to maintain it and or do variations of it.
Yeah.
You might do the uppers, then you might do the lowers, then you might do a touch-up of both, might need some muscle repair at some point. Like, the aging process around the eyes continues just like it does on the entire rest of the body.
Right. And, say if you're late 30s and you have premature aging of your lower eyelids, you may take the fat out, but you don't have a skin or muscle issue. You would do that suspension later on. Upper eyelids are pretty much universal in light-skinned people that they become redundant and have extra skin there. And when you do that surgery, it really depends on your presentation, where it really shows. And that can vary from people in the early 40s, late 30s.
It can be early 30s.
Yeah, up to 60s and 70s. So, it's just everyone's like an individual when it comes to their eyelids. It's so interesting that some people will present with upper eyelid problems and some only with lower. We really approach the eyelids themselves holistically. If you have an upper and lower problem, we really try to convince people to do it together. There's no reason to break it out if you're going to recover from a surgery.
Yeah.
So, but it won't stop the aging process.
No, it will not. So
that means we always have patients coming in.
Well, yeah, aging happens.
Yeah.
It's happening to all of us. Unfortunately, gravity, it's a thing. So who's a good candidate for this surgery? We're going to just assume any variation of blepharoplasty because you need to meet all these conditions.
Yeah. Well, Amy, you have to be healthy, right? Number one.
Healthy enough for surgery. There's a difference.
What are some of the things that define healthiness?
Well, specifically for this procedure, you need to have no serious eye conditions. That includes like severe dry eyes or vision issues, cataracts that are untreated. Any untreated eye condition you need to make sure is addressed first.
Yeah, there's conditions, Sjogren's disease, Graves' disease, chronic dry eyes that are moderate to severe, even mild dry eyes is a big problem, right? Visual issues. If you have if you have blindness or partial blindness, you may not want to do this procedure. So there's a lot of eye-specific things. But what about overall health? What do you need to be?
Yeah, so to be healthy enough for surgery, you need to be a non-smoker. You need to have blood sugars that are controlled, blood pressure that is controlled, not have any unmanaged healthcare conditions. Right. Cardiac health in check.
You don't want to have conditions that require you to take steroids, which can slow wound healing or affect it. If you're on blood thinners and if you have a heart history, right, that requires you to take medication. So, and that's just the beginning of that discussion.
Yeah, healthy enough for surgery is healthy enough for surgery. Elective surgery is not emergent.
Now, this bottom part here, I've never heard this before. I'm going to read it. Realistic expectations with a positive outlook. What is this business?
I actually put this on our facelift episode as well.
Yeah.
Because, or on all of our episodes.
It's on every single one.
Yes. Realistic expectations. We talk about this a lot. Listen to our episode of The Dark Side of Plastic Surgery if you want to know more about the dark side of plastic surgery, which is very much based around expectations and personal and perceived expectations.
That got a lot of views, and I think people were thinking it was going to be salacious. But it had a little salaciousness to it, but it was a very good episode.
Yeah.
Educational.
Yeah. And to be a good candidate for surgery, you should have a positive outlook about life. I mean, if you are, doom and gloomy going into surgery, you're probably not a great candidate for surgery just because, probably aren't seeking out surgery to begin with.
Right. And the other part of this is most people that are of the age that need a blepharoplasty, they also need a face and neck lift. And the mistake that people make is...
I would say that's not true.
Well, okay.
They will need a face and neck lift.
Some of them. Yeah. Okay, let's say more than 50%.
Yeah, probably 50%.
And a lot of people ascribe a result to their entire face just from their eyes, right? Now, don't get me wrong. It's transformative. We just talked to a patient who's very interested in it. She can do a face and neck lift and also her eyelids. She'd probably end up just doing the eyelids. But it's not going to transform everything on your face. It's not going to make you look, quote unquote, so much younger. It's very subtle. And that's what's wonderful about this procedure.
Yeah. And going along with a positive outlook, I mean, a lot of people who want to have a blepharoplasty want to have it because they feel like they look sad. Their eyes are downturned. They look poochy and tired. Yeah. So people are asking if they're sick all the time. And they're this super happy person. And people are constantly asking if they're sick.
I mean, who are these people that are going around asking everyone, are you tired?
Well, people ask a lot of things.
That's like a trolling move.
Yeah.
Right, Nils?
I know that is kind of the one thing you should never ask them. Like, oh gosh, are you tired?
Yeah.
Like you might as well just say like you look.
Well, you really look like crap today.
Like
Did you get a lot of sleep?
Like you're not looking so good today. Yeah. So
that was the best part of COVID. With the mask, you wouldn't see how like really you didn't shower that morning.
I don't know how that would cover up showering.
That's a good
Or
point.
brushing teeth.
Yeah.
Yeah,
brushing
maybe
teeth.
brushing your teeth.
Yeah.
Yeah. It would cover up the maskne that it gave you.
That's true.
So, yeah. All right. Let's take a quick break. When we come back, we're going to talk about how to choose a surgeon, what to expect as far as consultations, all that kind of good stuff goes. We're back. So now you know what a blepharoplasty can address and if you're a good candidate for it. You're healthy enough for surgery, you got a positive outlook on life, you have excess eyelid skin.
Or excess fat, or both.
Or both.
Yeah.
Yeah. Or muscle weakness. It goes on and on. All right. So Dr. Martin, let's talk about the types of blepharoplasty because I think this is where people kind of get confused of what does what.
Yeah. So when I look at eyelids, I break it down to the upper and lower eyelids. I think that's the first delineation point. Would you agree with that?
Yeah. I mean,
Yeah.
there's full, like, right? You need both uppers and lowers.
Right. So, and when you need an upper, it could just be for the skin, or maybe you have too much fat. If you need a lower, it could be for the skin or too much fat, or both on both places. So whatever variation that is, and obviously that's very subjective. A lot of times in our office, we'll just do uppers alone. And that's easily done under local anesthesia. I'm sure we'll have a second part of this where we talk about the surgeries
Yes,
itself.
we do.
So usually that's only skin. Rarely do we take a lot of fat out. Again, we talked about that before. That's something we did in the old days. You don't want to clean out the eyelids too much. It skeletonizes everything, and it has a harsh appearance. So it's really kind of taking out that skin and reinforcing or redefining the supratarsal crease. How would you describe that crease, Amy?
Where your eye folds when it's open.
That's right.
Yeah.
Yes. And actually, because you put that scar in the crease when your eyes open, you will not see the scar.
Which we talk about more later too.
Cool. The lowers are really subjective, but most of the time that involves taking out fat and also maybe a little bit of skin. That incision, unlike the uppers, which is in that crease, is actually right underneath your eyelashes in most cases if you need that type of incision, or we do it just for the fat. I'll go through the eyelid on the inside of the eyelid. That's called transconjunctival approach. None of these words really mean much. But you
should know them, though, if you're considering this procedure.
Yeah. But you go through inside the eyelid and take the fat out there, and it's less invasive, no external scars, which is pretty awesome. What I do now, and what a lot of people that are advanced do with this procedure, is we'll resuspend the muscle too. You know, it's funny, AB. Everyone thinks that, certain places in their body don't age or don't sag, like their belly or their arms.
Who thinks that?
I don't know.
No one who listens to this podcast thinks that.
Oh, that's true. We're all educated citizens.
Like,
here.
I don't know who thinks that there's no part of their body that sags with age and gravity.
But, gravity,
even
age,
your nose, we
right.
talk about that.
You're right. Gravity and age
Ears.
affects your lower eyelids. It causes loose skin, loose muscle, and the ligaments or the supportive structures that hold your eyelid in place. There's also something called a tarsal plate, and I have no idea how to describe what that is other than a batten in a sail. If you've ever been on a sailboat and there's battens that go in that keep the shape of the sail itself, has anyone ever seen these battens?
Like a hammock. I would call it like a hammock.
Okay.
Like it's
well,
like
there's
that.
an actual structure in there at the edge, right underneath your eyelashes, that keep the structure of the eyelid. That can actually loosen over time too. So it's an amazing amount of changes that occur with age. So in these lowers, you're going to definitely do some fat, maybe some skin, and probably a muscle suspension, and even a shortening of the lid if the tarsal plate is stretched out.
Yeah. So to kind of thin that all out a little bit, what are the types of blepharoplasty? There's a full, which is upper and lower. And an upper and lower can be a combination of several things. Upper being skin only, or skin with maybe some fat removal or muscle repair. Lower can be skin only, which is external. There's an external incision, or transconjunctival, which is that inside the eye incision, or just fat. So you just go in and pull out the fat. So there's lots of variations, all blepharoplasties.
Amy is by Google Translate. Was before I was really trying to speak English in layperson. It was just not coming out.
You just gave the whole rest of the podcast right there.
That's good.
All right. So what are some important things to think about when choosing a surgeon?
I don't know. Nils, can I ask you a question? What would be the first thing you would look for someone who's a specialist in eyelid surgery, if they are?
Oh man, this is a tough one, but I'm gonna have to say board certification.
Yeah. So for our purposes, board certified by the American Board of Plastic Surgery. However, there are many oculoplastic surgeons who are extremely well qualified.
Yeah.
So either one.
And ENT surgeons too. Yeah.
If you want to know more about specifically how to find a surgeon who does eyelid procedures, we talk a lot about oculoplastics and plastic surgeons on our New Beauty, How to Choose a Surgeon episode, which is fantastic. So it'll kind of tell you the difference between what a board certified plastic surgeon does versus what a board certified oculoplastic surgeon does, but both are extremely qualified to do these type of procedures. My reminder always, there is no board of medical specialties recognized by the American Board of Medical Specialties
I feel like you have a bumper sticker with this.
that has this name cosmetic surgery in its name. So if your doctor is cosmetic surgery board certified, that is a different thing. You can do more research on some other podcasts about that, but that is not the same. So finding someone whose results and aesthetics match your desired outcome, especially with the eyes, I think that is the one thing where people will pull out a celebrity and say, wow, what happened to them? And it's because their eyes look
different,
not natural.
Yeah, not the almond shape. They look round. They look tethered and weird. Something's
too
off.
Open, too thinned out almost even.
And the eyes are so important because when you look at people when they're talking, you look at their eyes or their mouth, right? I look at Amy's beautiful eyes.
Oh,
Amy, yes.
You have nice eyes too.
I have wrinkly eyes.
Nils, his eyes look super blue today because he's wearing a blue shirt.
Oh, yeah.
Yeah.
Are you feeling it, Nils?
Yeah. He's got
Oh, yeah.
ultra blue.
But so any kind of distortion on the eyelids is really noticeable.
And sometimes hard to fix.
And hard to fix. Yeah. So I think it's really important that you find someone with your aesthetic vision. But I would assume that most people watching this right now don't have an aesthetic vision of looking distorted or weird in the eyes. I don't think to most patients want that.
To be fair, there are patients who do want to change the shape of their eyes for a variety of reasons, ethnic or just their own kind of aesthetic, or want a position of the eyelid that maybe is more open or alert than is really natural or age appropriate. So I think it does happen,
right?
And there might be the difference though is that there might be surgeons whose that is their aesthetic. So finding out that your surgeon has an aesthetic that is perhaps not yours or is overly alert or changes the ethnic appearance of your eyes in a way that you do not want. Those are things to definitely watch out for.
There's a whole subculture in blepharoplasties that do ethnic conversion surgery.
Yep.
So with Asian eyelids to make them look more Western eyelids. We've talked about this before.
Yeah.
And I find that very interesting. They're very, very good surgeons. They're very subspecialized, and that's what they focus on.
Yeah.
But if we're talking about the standard patient that comes in that wants to look like themselves, is better, less aged, then you want to find someone who matches that aesthetic, but also who's not aggressive. And that's the main thing with eyelids. I tell this to the fellows all the time, is you really have to find that middle ground, that Goldilocks area where you're not overdoing it. Everything has to be you have to ratchet it back a little bit. You have to, actually in the OR, I slow myself down. I go slower with the eyelids than I do with the face and neck lifts for that reason, because I want to make sure that I get it absolutely right, because every teeny millimeter counts.
Yeah, you're working in such a small area.
Especially when you're removing skin.
Yeah, because once it's gone, it's gone. And there's not a lot of coming back from that. We'll talk more about that with our questions to ask, but it's a very precise surgery. So you want to slow down.
But you should feel comfortable with somebody. Look at their pictures. They should give you a good feeling. They should match, whatever their plan is, should match what your kind of expectations are.
Yeah. All right. So at the consultation, you've made the decision, you're going to do a consultation. What's going to happen? Well, they're first going to take your full health history. Now, you may think that seems ridiculous because it's such a little surgery. Like, they don't need to know all this stuff about you. They absolutely do. Current medications, allergies, supplements. Supplements are really big in this category because if you're taking things that are going to thin your blood and make you bleed more, like, it's going to be very apparent when you're trying to have an eyelid surgery. History of smoking, drug use, previous surgeries, any issues you have ever had with your eyes.
I don't know what it is about this. We ask that question directly, and sometimes people don't even respond, and then they'll say randomly afterwards, "Oh yeah, I have dry eyes." I'm like, well, that would have been nice, not after the surgery, but at a later point.
Yeah. Or I had a detached retina at one point. I mean, crazy stuff comes out.
Or I had corneal surgery. Or
I was that person on a shop class wall that had the piece of the metal barb in their eye.
Like, I had one lady who's like, "Oh, I forgot to tell you about my glaucoma." I'm like, well, that's kind of important because we inject local anesthesia around there. So it's really important when you go in for these consults that you give a full health history. Do not mitigate that. Don't blow that off. That's really important. Yeah. By the way, there's very few. If you go to a talented, experienced, board certified surgeon that does these procedures, you should be good. There's only a few things that really are scary with these procedures in terms of outcomes that are concerning, and one of those is bleeding. Bleeding can lead to something where the blood pools behind the eye.
We're going to talk about that.
Yeah, well, we'll talk about that, but which can cause pressure and then ultimately lead to blindness. So and the eyelids are so thin, they swell a lot. If you bleed a lot and bruise a lot, it's just going to make your recovery that much worse. So you really want to make sure that you're not taking anything or doing anything that might thin the blood and make bleeding more, make the bleeding potential more prominent for the surgery itself.
That's why I emphasize supplements so much with this one, because a lot of people don't think about things like pre-workout or like some fat burner they're taking that might have a lot of caffeine in it. All those things are going to make you bleed. So just bring a list with you of every single thing you take during the day, even if you think it's not related to your health, like a pre-workout. So you'll get to discuss your options, your outcome. You'll get a quote. So that's when you'll find out how much this is going to cost potentially. Review the risks and potential complications, as we are going to go into in detail in part 2. Look at before and afters. Get photos of people with similar expected outcomes. I think we talk about this again in our episode about the dark side of plastic surgery. Just because you like a picture of someone doesn't mean that you are going to be anything like them. So asking your surgeon to show you pictures of people in your age group with your similar presentation is really key. Like, you have a much better idea of your outcome.
Right.
Yep. Answer all your questions, which we have, and we'll link this in our description box below, the questions to ask your surgeon, because these are things you should definitely ask your surgeon. Number 1, are you board certified by either the American Board of Plastic Surgeons or the American Board of Oculoplastic Surgeons? I was so many words in my mind, so many O words. Am I a good candidate?
Are you going to try to say otolaryngology?
Otolaryngology? No, but I am waiting for the end of the year when I get to hear that as a wrap.
Yeah.
I'm no longer afraid of that word. Bring it on.
You're not afraid of it?
No. All those ENTs out there who are trying to terrify me with their scary sounding name.
Yes.
Yes. What surgical technique is recommended for me? So going back to our slide where we talk about the different types of blepharoplasty, which one and why?
Right. Where and how will you perform the surgery? But where will you perform the surgery? We have a great episode on that. I don't remember which one, but where we talk about the facility and is it accredited and is it clean and do they have good outcomes? What are the risks and potential complications with a blepharoplasty? I mean, these are so essential for you to talk to with your surgeon. And how will complications be handled if they do occur? We bring this up with our patients. We talk openly about it. So I think it's really important you have that conversation with your surgeon. And then how can I expect my eyes to look and age over time? One of the things I would add to this is, what do you think I'll look like after surgery, right afterwards? Having realistic expectations about how swollen you may be with surgery is kind of important. This is a surgery that swells a lot and people get a little bit concerned right afterwards.
Well, but it doesn't. I mean, and with newer techniques like adding in TXA to MES or to the local, like there are things that we do now that cause far less swelling. We have patients who don't even bruise, and that's not even the exception anymore.
Yeah.
So, yeah.
Or I could just be getting more talented.
I mean, that's it too, so skill makes a difference, but ultimately there will be some bruising and swelling. And that is a great question to ask.
Yeah.
We'll talk more about questions you should ask at your pre-op appointment as well. And some of those are included there as well. So these are in the description box if you want to take these with you to your consultation. Highly recommend
Print it out and just read off of it.
Yes.
Yes.
So you've decided to have surgery.
Yep.
You've chosen your board certified plastic surgeon.
I can't wait to get my eyelids taken care of. Yeah.
What do you think is going to happen at your pre-op appointment? So number 1, Dr. Wright, you talk about these things.
We're going to take photos.
Mm-hmm. This is part of your medical record.
Right.
This is not for vanity. This is medical record stuff.
And we don't like people dressing up in makeup and wearing their family jewels over here, so this is a real photo of what you really look like. We review the health history again, and I actually do a history and physical on everyone, a real one, with paperwork to be sent to the surgical facility. We order the preoperative labs or look over those. We prescribe the medications and really just tell you when to start and stop those. The EKG is very important for these kind of cases. If you're going to the operating room and you're getting anesthesia.
And you're over 50.
And you're over 50, yeah. We sign the consents and the final payment. I don't deal with that. I don't deal with turning in the RXs.
Yep. So
I don't deal with the date.
Nope.
What is all this stuff on here? I don't deal with this.
So in most cases, you can expect also to make your final payment at pre-op. Most offices are going to have you pay in full prior to surgery. Same thing with the hospital. Same thing if you're having anesthesia, the anesthesiologist. Everybody needs to get paid, and this is going to happen before surgery.
Yeah. Anything elective, you're going to have to pay up front.
Yep.
You're not going to pay afterwards.
We'll talk to you about where you want prescriptions sent into, what prescription those might be, review the date and time of your surgery, and then, of course, answer any questions that you may have. And we have a great episode where we talk all about pre-op appointments, but here are some simple questions that you should definitely, for yourself at least, ask so that you should know the answer to all of these as well. So if you do not know the answer to these, you need to ask your surgeon because these are all very important. Where will I be taken after surgery? Are you doing an awake procedure where you're going home after surgery? Will you be staying overnight in the hospital? Like, what happens after surgery? What medications will I be given or prescriptions? Will I have bandages or dressings? This is a great question. Are your eyes going to be completely covered? I mean, It's not like with LASIK, right? You have LASIK surgery and you have to wear those like eye patches over your eyes for days. You know, is that what it's going to be like, or do you have nothing? When will they be removed? Do you have to stay like this forever?
Oh, the glasses or contact lenses. Such a good question.
Mm-hmm. Yeah.
What do we say for contact lenses, Amy?
It depends on what you're having done. So a lot of times patients who just have their a transconjunctival lower eyelid procedure done
through the inside of the eyelid.
There's no external incision. So, 2 days after surgery, they're like, well, can't I put my contacts in yet? And I'm like, we could literally cut the inside of your eye open, not your eyeball, the eyelid. So no, like your contact could become abraded. It could stick. So there are reasons why you cannot wear contact lenses.
Theoretically, it could slip into the area where we took the fat out.
This is like urban myth right here. And the contact is floating around inside your eyeball.
And then it migrates to your arm. And you wake up in the morning and you have a contact underneath your index finger.
Yeah.
What is going on, people?
So you can wear your glasses right away. And you can expect to have some blurry vision right after surgery.
Oh, yeah.
And we'll talk about that more as well when we talk about the phases of recovery. But typically, you're going to be cleared to wear your contact lenses. Now, that's going to vary based on your surgeon. Usually, once all your sutures have been removed, probably 24 to 48 hours after that point in time. If you've had an incisional surgery that has no sutures, it'll probably still be a week.
Yeah.
So plan for a week of no contacts, but you can wear your glasses right away in most cases.
What about showering and washing the face?
Yeah.
When is that?
Washing
At least
your
for
face.
us. Again, when we say our experience, you got to listen to what your surgeon says, but go ahead.
Yeah, and these are questions you should ask your surgeon. Even though we're giving you our answer.
Even though we're giving you the correct answer, but it's okay.
It's our answer.
Yeah, it's our answer.
In most cases, 24 hours. You can shower. You don't want water pounding down on your eyes. So I tell people that just do gentle splashes of water rather than letting the shower hit them in the face. You don't want to do anything abrasive or scrubbing over the incisions. You don't need to. That's where people think like, well, don't I need to clean these incisions? Like, no, you do not.
Do they really?
Every day I get asked that question.
I don't know how you do your job.
Yeah.
I would have such anxiety. I'm like, do not touch your face, please.
Yeah. I do tell people,
for
stop
the sake
touching
of
it.
God.
Yes. And then, of course, when can I return to normal activities, exercise? And those are going to be normal activities for you. So that's why I say it's important that you know the answer to these questions because it's going to be different for every single person listening.
One of the things is to ask the surgeon also, we'll talk about this afterwards, about your head position after surgery. Most people want to keep your head elevated, so you're going to have to prepare for that with your bed when you go home. That's important. And then...
that is in our preparing for recovery slide.
Yeah, it is. Okay.
Yes.
Yeah. And then the activity stuff is, a lot of people think after these surgeries that they can't do a lot. You can actually do a decent amount of stuff, but it's like nothing to elevate your heart rate and blood pressure. So, normal stuff, even emails, if your vision is good enough, are going to be totally fine. So you could probably do work duties within a couple days after surgery.
Yeah.
Non-physical work duties.
Yep. So that is a great teaser for our next episode because when we come back in part 2,
I was totally teasing everyone.
The end of part 1, we are going to talk specifically about how to prepare for recovery, and we will actually go through the surgery in steps, by step what the surgery entails, and then also week by week what you can expect during recovery. So the first few days after your surgery, all the way up until you are completely fine and have no restrictions at all. So that is what you can look forward to in episode 2. And something I failed to say at the beginning of this episode is that I love voicemails. This is the time. The time is now to put all of our social media handles here. So if you have listened all the way to the end of this podcast, I thank you very, very much. It would be hugely appreciated if you would like this podcast.
Now that she knows how to access her voicemails.
Now that my voicemails are actually syncing again, yes, I can listen to voicemails. So the phone number for voicemails is 303-630-9038. If you are a listener only, then you did not see that flash up on the screen, but you can find all of our social media at Beauty and the Surgeon Podcast and at Jason Martin MD on YouTube and Instagram. I do love and appreciate the comments. And again, apologize for the snafu I had at the end of 2023 with my phone conversion. But we get great comments, and I really do appreciate everybody for listening. It makes such a huge difference.
It's the best part of this. This is your comments and your interaction.
Yeah. And subscribe. It's free.
All right. So we're going to the next part, which is my favorite part, the surgery itself.
Part 2. We'll see you in 2 weeks.